Hello friends, welcome back to Complete Medical Coding. Today I am here with an important topic, colonoscopy. Okay, colonoscopy, how the procedure is being carried out, what are the diagnoses that the doctor gets from or while doing colonoscopy, what is the procedure, what are the guidelines, all these some important points I'll be discussing in this video, because such type of topics are very important for you. Even this will help for your examination as well as for your career. Okay, for the preparation of interviews and all, you will definitely get questions from such type of topics. Okay, so I'll be doing few topics like this in between the mock questions and the practice questions. Okay, so today we will learn about colonoscopy. Friends, if you are new to the channel, please subscribe, please support me, okay, and please share it among your friends. So let's move to the topic. What is colonoscopy? What do you mean by colonoscopy? See, those who are from life science background or those who are from any medical science background, they will be knowing what is colonoscopy, or they will be knowing all these terminologies, anatomical terminologies, okay. But those who are not from the science background, especially for those people, the videos that I'm doing like this, like terminologies, will be more useful. Okay, so if you are from science background, definitely you will be knowing all these terminologies. So those who are not from the science background, these videos are specially I'm doing this for you guys. Okay, and you can share it among your friends as well. Anyway, I'm not extending the video. Yeah, let's move to colonoscopy. What is colonoscopy? What is colonoscopy? As you know, it's a type of endoscopy, right? It's a type of endoscopy that looks inside your colon. From the word itself, colonoscopy. So it is something related to colon. So that is an endoscopy that looks inside your colon with a special scope inserted through your anus. It is inserted through the anus, and then the doctor will see. It's an endoscope that the doctor will see inside the colon, what is happening inside the colon. Now, a colonoscopy is an examination of the inside of your large intestine, especially colon. Yeah, large intestine, large intestine, that is especially colon. Who is performing colonoscopy? Which specialist doctor is performing colonoscopy? Mainly a gastroenterologist. Okay, mainly a gastroenterologist or a colorectal surgeon. Colorectal surgeon performs a colonoscopy. Okay. Now, why would I need a colonoscopy? Why is the patient doing colonoscopy, or why the doctor is telling the patient to do colonoscopy? Okay, why, or what is the importance of doing a colonoscopy? It's helpful for diagnosing gastrointestinal diseases such as inflammatory bowel disease and colon cancer. Yeah, mainly colon cancer and some gastrointestinal diseases such as inflammatory bowel disease. So all these things can be diagnosed. It can also help treat and prevent colon cancer. It can help in the prevention or treatment of colon cancer. Your healthcare provider may advise you to have a colonoscopy for routine cancer screening if you are at a statistically higher risk of developing colorectal cancer. Okay, so why your healthcare provider or why your physician is advising you to do a colonoscopy? It's important. Okay, why a patient is doing colonoscopy? Because that helps in routine cancer screening. This is a procedure for routine cancer screening. Okay, colonoscopy is a procedure for routine cancer screening. All right. Now, who needs to do colonoscopy? Who are the patients that has to do colonoscopy. You may be due for a colonoscopy for cancer screening if you are older than 45 and haven't had one. It's a cancer screening. It's a screening test, cancer screening. So cancer screening. So this colon cancer usually occurs in people who are aged above 45. So if you are older than 45 and have not done yet, you can do one colonoscopy procedure to detect colon cancer. Okay, or to help in. That is a cancer screening. Now, if you haven't had one for 10 years, so it means when you reach 45 years of age, every 10 years, it's important for you to do a colonoscopy. Once in every 10 years after reaching the age 45. Now, if you had tissue removed during your last colonoscopy, whenever you did colonoscopy, and if some tissue has been removed, then you have to again do colonoscopy once in every 10 years. If you have a family history of colorectal cancer, if there is any family history, as you know, cancer, for any family history, we have to do cancer screening. So say similar to that, any family history of colorectal cancer, you have to do colonoscopy. Then, if you have inflammatory bowel disease, for any inflammatory bowel disease also, you have to do colonoscopy. Now, what are the symptoms that might require a colonoscopy? What are the symptoms that are seen in you that you need to do colonoscopy? That you need to know that I have to do a colonoscopy. Okay. Unexplained rectal bleeding or discharge. If you have an unexplained rectal bleeding or discharge, if you have an unexplained changes in your bowel habits, such as diarrhea, constipation, or incontinence. If you have unexplained persistent abdominal pain. If you have unexplained weight loss or lack of weight gain in children. If it is in children, unexpected weight loss or weight gain, unexpected weight gain in children. So if you have these symptoms, you may recommend to do a colonoscopy. Okay. Now, colonoscopy will diagnose. So if you do a colonoscopy, what are the conditions or what are the diseases that can be diagnosed through a colonoscopy? That is also an important question that you might get in your exam, in terminology exam or in interview. Okay, what are the conditions or what are the diseases that can be diagnosed while doing colonoscopy? What are the diseases? First one, ulcerative colitis or Crohn's disease. Ulcerative colitis or Crohn's disease. Okay, you might get a question like this. Crohn's disease, it occurs in which part of the body? Colon. It's in colon. So like that, similar questions you will be getting. If you understand one topic fully, then you might get several questions. If you get any question which is related to that, you can easily score marks and you can easily perform in your interviews as well. Okay, so colonoscopy will diagnose ulcerative colitis or Crohn's disease, intestinal ischemia and ischemic colitis, diverticulosis and diverticulitis, ulcers and perforations, large bowel obstructions, colorectal polyps and colorectal cancer. CRC is the short form, okay, of colorectal cancer. So all these 6 important diseases can be diagnosed if you do a colonoscopy. Okay. Now, during colonoscopy, the endoscopist can. What are the things that an endoscopist or the gastroenterologist, whoever is doing the colonoscopy? So during colonoscopy, what are the procedures that they can do along the endoscopist or the gastroenterologist can do along with while doing colonoscopy? What they can do? They can remove polyps. Okay, if there is any polyps found, they can remove polyps. That is called as polypectomy. Removal of polyps is known as polypectomy. Okay, so remove polyps, seal wounds. If there is any wounds, they can seal wounds, inject medications, remove blockages. there is any blockages in the intestine, you can remove blockages, place stents, treat tissues with laser therapy. So all these procedures can be carried out during colonoscopy procedure. Okay. Now, how to code a colonoscopy? Colonoscopy coding, it's direct in the CPT code book. If you go and take 45380, the CPT code 45380. Colonoscopy flexible with biopsy, single or multiple. Okay, 45380. Two codes are mostly used for colonoscopy. Colonoscopy flexible with biopsy, single or multiple. Okay, that is 45380. And 45384 is colonoscopy flexible with removal of polyps. Yeah, if it is including any removal of polyps, tumors, or other lesions by hot biopsy forceps, you have to use the code 45384. That is only simple, single or multiple with biopsy colonoscopy, then 45380. If colonoscopy is done with removal of tumor or polyp, use the code 45384. Okay. Yeah, so that's it. These are some this is one important terminology, colonoscopy, that you have to, as I told you earlier, that you need to understand how the procedure is carried out, what are the diseases that can be diagnosed while doing colonoscopy, how to code colonoscopy, everything. Okay. Hope you like this video. If you like, if you found this video useful, please like and share it among your friends. I'll be coming back in the next episode as an important mock question. So stay tuned, friends. Hopefully by tomorrow I'll be coming back with mock questions. Okay. So thank you so much, friends. Take care. Bye. Please subscribe. Please don't forget to subscribe if you are new to the channel. Okay. Thank you so much. Bye. Take care.